Look like an English gentleman or something. Hi, I'm Bob Shupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we are the most famous physical therapists on the internet, Brad.
In our opinion, of
In our
course.
opinion. Brad, today what are we going to talk about?
Well, Bob, I thought we'd talk about the Packers. No, I'm just kidding. We're going to talk about hip bursitis.
Top 3 steps for treating hip bursitis. You know why we're doing this topic, Brad? You don't know why.
No, I really don't.
My cousin
Oh,
contacted me through Facebook, and she has hip bursitis. And I won't say her name, but it rhymes with Honda.
Oh.
There's a lot of choices there. You think there's only maybe 1 or 2, but there's actually a lot.
She's named after a country. Rwanda?
See, that would be a possibility, wouldn't it?
Well, anyway,
One of my favorite cousins, anyway, she fell and got pressure directly right on the bursa, and she had pain. In the end now, we're not sure that it really was a bursitis, to be honest with you. Because it didn't get better, and she got a shot and all that. But anyway, so I've still promised her we'd do this video.
Sure.
So top 3 steps. Number 1. Well, first let's talk about what it is.
Yeah.
The spine.
You better
Brad?
believe you can, Bob. Here, catch this.
Oh, thank you. All right. Basically, what we're often talking about is trochanteric bursitis. Now, here's your hip.
You're throwing on a lot of big words, Bob.
Yeah.
Let's clear this up.
This is the greater trochanter, isn't it, Brad?
Yeah. Now, if you look, a lot of people think the hip is like up in the belt line, but it's really below the belt line, right where my finger
so
is.
this would be right here. This is the hip.
Right there,
And-
right there.
Right.
Mhm.
Now, on top of this bone, basically, is a fluid-filled sac. Are you picking up this, Nancy? This is amazing stuff here. Now, I wanted to have like a rubber ball that air-filled, you know, because that's kind of how you would look at it, and that's how a fluid-filled sac would look.
Push this thing
Yeah, if you
off.
squish it down.
Yeah,
Well, we didn't bring our rubber ball today, so anyway,
It keeps falling.
this is probably a little large,
Yeah.
but this is how it would be, a fluid-filled sac, and then structures go over the top of that, and that helps stop it from rubbing over bone, basically, right?
Like a lubricator, so the tendons and the ligaments don't get wore out when they go over the bone edges.
Right.
And
One in particular would be the IT band. The IT band, or you maybe if you've heard of the iliotibial band, goes right over the top of that, and that. So basically, I think most often, more than not, bursitis injury is a repetitive injury, overuse.
Right.
You're doing something that causes it to rub, and then it gets inflamed,
Right.
fired up. So we got to get that inflammation down.
right.
Right, Brad? That's step number 1. So how do we get inflammation down?
Well, we need to decrease whatever irritated. So if you were doing a lot of walking, you're maybe running, you may have to.
That's step number 2, Brad.
Oh.
Step number 1, we can do what? Ice.
Ice, yes.
Ice packs, ibuprofen. As physical therapists, a treatment that we often use is, could use iontophoresis or phonophoresis.
Sure.
You don't know what those are, but they will decrease inflammation.
We do have videos on those as well.
Yeah.
But
And then if you get the doctor involved, and it gets to that point, you could have a cortisone shot.
sure.
And from what I read, those are very highly effective. They do tend to work pretty well.
Right.
So, all right, but let's say you're not to that point. Let's say step number 2 is to decrease the stress on the hip, Brad. And one of the ways and this is what I recommended to my cousin, whose name rhymes with Honda, she's my favorite cousin, is that she use a cane. And she was reluctant, I could tell, and she finally went to a physical therapist who also said to use a cane, and she did, and she started having less pain. I don't know if it was because of the cane or she had mentioned some other things.
From the pain.
Brad, let's say you have bursitis on the what side do you want to have?
Right hip.
Right hip.
Right. A lot of people would think use the cane in the right hand, but not true. Always the opposite. My cane is too tall, but we'd have to adjust it down to here. I'm not going to do that right now. But you do it opposite hand,
Yeah.
and you would, as the right foot goes forward, the cane will follow, and you'll unload that hip every time you take a step. A lot of the force on that trochanteric bursitis is going to actually go through here, taking out inflammation.
Can make a huge difference.
You bet.
If I were to do one thing, this is what I would do.
Sure, you bet.
The people that and we're not telling you to use a cane for the rest of your life. All we're telling you is use the cane till your inflammation calms down.
Right. So you're going to ice it, maybe some ibuprofen, get a cane. Those are 3 things you don't have to see a doctor or a therapist
That's
for.
right. You can just start off, avoid stairs. I wouldn't lay on it at night either.
Right.
If your bursitis is on here, don't lay on it all night long. So what you'd rather do is lay on the other side, and even then, Brad, do you want to grab that pillow?
Sure. Put it between.
Yeah, because if this is the hip that's bothering you, if you're putting like this, even this is putting stress on it.
Right. A
It's
lot of times
stretching
you'll
right
end
now.
up going up
Yeah,
like this and
yeah.
that.
And that's stretching on it all night long,
Right.
irritating all night. So this is just a way to calm it down. Obviously, you can sleep on your back too.
Sure.
So probably stomach also, but this would calm
If you're
it
a
down.
side sleeper, you're gonna do that. And then sometimes, go back down, Bob, I'm gonna show you this. Sometimes what I do, or I have my patients do, if they like to roll from one side to the other, we'll put pillows on this side. So
Oh,
then,
to prevent them from
right, when
rolling.
you're sleeping, you roll over without thinking about it, you end up on that side and your hip is sore. So you put a couple pillows there and that'll be a physical reminder. Either that or you have your spouse go right up next to you and tell her to stay there all night long and then you can't roll over on top
Well,
of
a
her.
radical idea I heard, which I've had suggested, is that you sew a ball into your shirt, a little tennis ball or something.
Yeah.
And if you roll over onto that side, it won't let
Oh.
you roll over onto it.
Another use of the tennis ball.
Yep, those tennis balls come in handy.
What else
don't
do we
they?
got with these?
I think that's it for decreasing the stress. Like I said, you want to avoid any repetitive activities, probably bicycling, stair climbing. What other activity would be bad for?
Well, jogging, but
Jogging,
you'll
yeah.
know because when you do the activity, it irritates.
Right, if the activity irritates it, you don't want to do anything that's going to make it worse. Oh, don't carry a heavy purse, Brad. I know you're prone to that.
Yes,
You got to lighten up that purse. All right, finally, number 3. That was number 1, decrease inflammation. Number 2 was decrease stress. And number 3, we're going to give you 2 stretches and a strengthening exercise.
Sure.
I'll show you the first stretch. I'm stretching this side. Okay, Brad?
Yep.
I'm gonna lay down. What you're gonna do is you're gonna cross your leg over like this, like a figure 4. And then you're gonna bring this leg up like this, and you can even bring it up further by grabbing like this. This is stretching that hip.
The one on the back side, not
Yeah.
this hip, but the
I'm
other.
stretching this hip. So you, again, kind of just cross the ankle over the leg, over the top of the kneecap,
Yep.
a little bit above the kneecap, making what is called a figure 4.
Go on to the stretch. they
Bringing
got.
this up. I'm just getting into detail, Brad. And then we stretch it like this.
What's the second one?
The second stretch, you want to show that one against the door?
Oh, no, you show. I don't like that one.
Oh, Brad doesn't like this one.
I think it's a good stretch, but so many people have a difficult time doing it properly.
Okay, legs are quite far away from the door. Okay? And what you're going to do is I'm stretching this one, is I'm just going to cross over like this and go down like this.
Yeah.
It's a good standing one when you can't lay on the ground.
Right. You got to be fairly nimble for this, you know.
As I am.
Right.
Even though I'm 50 and over,
How long are you gonna hold these stretches, Bob?
I'd say 15 to 30 seconds.
Sure.
All right, and then the clamshell. Do you want to do that one, Brad? Or is there anything you want to do right now besides just make comments?
You're doing really good, Bob.
All
You
right.
Continue.
This is the clamshell. Again, I'm going to strengthen the hip on this side. You start off the bent over fetal position, I guess is what you would be. And very simple. All you're going to do is you're making like a clam here, opening up the clamshell. Believe it or not, this one, Brad, if you don't do this one much, if you do 15 reps of this, you'll feel it.
Oh,
I mean,
yeah.
a lot of people don't strengthen their hips, so you really, I'm feeling this now, and
I
I
believe
do this exercise.
Well, Bob, I'm not
Okay.
telling you.
If you're 40, 50 and over, you're going to want to subscribe to us, by the way, because we're going to give you lots of hints on how to stay healthy and pain-free well into your elder years.
Right, and if you're 40 or 50, we're gonna help you take care of your parents as well as we are.
Because they're over 40 and 50.
Right, they're probably 60, 70, and 80. They
Right.
need some other information.
So, subscribe to us down here, and we love to hear your comments too.
You better believe it.